It began with a promise whispered in every dark corner of psychiatry. What if fear could simply be deleted? After all, medicine had long conquered pain. Anesthetics silenced the nerves, tranquilizers softened thought, opiates drowned grief. Only fear, the body's ancient alarm, still refused to shut off. Every predator inside and outside humanity fed on it. By the 20th century, the question was no longer philosophical. It was pharmaceutical. In laboratories funded by militaries and universities alike, scientists began to tinker with terror itself. They believed they could turn courage into chemistry. They were wrong. The story begins properly in the early 1950s at the height of the Cold War, when governments decided the mind was just another battlefield. Soldiers returning from Korea described captors who could re-educate prisoners through relentless psychological manipulation. Western intelligence agencies assumed there must be a drug behind the miracle. Within months, they were testing tranquilizers, hormones, and electricity on volunteers, and occasionally on people who never volunteered at all. Chemists discovered a family of compounds that blunted panic with mechanical precision. The first was meprobamate, known under gentler names like Miltown and Equinil. It worked by dampening neurons in the amygdala, the almond-shaped structure that stores and triggers fear. Take enough and nothing frightened you. Not needles, not loneliness, not war. It was marketed as serenity in a tablet. In middle-class America, prescriptions mounted faster than aspirin sales. For a brief decade, anxiety appeared curable. The media called it the peace pill. But serenity at scale carries strange side effects. Hospital staff noticed patients walking in front of cars, burning themselves, or falling asleep with hands on open stoves. They weren't suicidal. They were indifferent. Indifference, it turns out, kills faster than terror. Fear is an evolutionary alarm. Remove it and organisms forget the line between risk and safety. Neuroscientists would later term this emotional disinhibition. In plainer words, they had invented the chemical that erased fear, and everyone who felt it. Still, laboratories pressed forward. The next generation of researchers wanted something cleaner, faster, controllable by switch. Wilder Penfield in Montreal mapped memories using electrodes. José Delgado at Yale implanted fine wires into animal brains, sending radio pulses that could make a charging bull freeze mid-run. His dream was psycho-civilization, neuroengineering human behavior into peace. When he demonstrated the technique on stage in 1963, newspapers hailed him as the man who could turn aggression off. Few noticed the other implication. If you can silence aggression, you can silence will. Through the 1960s and 70s, experiments expanded into areas we would now call unethical and then called progress. At the Allen Memorial Institute in Canada, patients undergoing treatment for depression and addiction were subjected to deep sleep therapy. They were kept in comas for weeks under heavy sedatives while being played recorded affirmations that claimed to erase trauma. Many never fully woke. One of the lead psychiatrists later admitted they were trying to rewrite behavior without consent. Funding came quietly from intelligence channels. Fear was not just a symptom anymore. It was a political liability. As psychopharmacology evolved, purpose shifted from control to cure. In 1979, neurologists at Duke University discovered that stimulation of a small region in the midbrain could permanently block conditioned fear in animals. This was hailed as the seed of a future trauma treatment. By the 1990s, between post-traumatic stress in soldiers and anxiety epidemics in civilians, the global demand for such therapy was enormous. Every company wanted the first FDA-approved drug that could erase memory of fear without erasing the patient. They thought they found it in polypropranolol, a beta blocker designed for high blood pressure. Doctors noticed that patients taking it after a traumatic event recalled the memory but not the terror. Headlines again erupted. The pill that erases fear. Trials expanded inconsistently. Some showed promise, others flat failures. Yet while the pills dulled emotion, they also dulled empathy. Soldiers described being able to recount atrocities like narrating someone else's story. Critics warned that trauma's pain is what teaches morality. A society without fear might also forget guilt. Then came the machines. Functional MRI allowed scientists to see fear firing in real time, networks glowing across the amygdala and frontal cortex. From there, the logic was inevitable. If you can see it, you can target it. In 2001, researchers at a U.S. Air Force hospital began testing localized magnetic pulses, transcranial magnetic stimulation, to disrupt traumatic flashbacks in pilots. At low levels, it calmed nightmares. At high levels, it produced memory blanks. Internal reports mentioned psychiatric flattening and loss of affect in volunteers. Translation: emotion deleted. The technology spread rapidly into civilian medicine. Clinics marketed it for depression, addiction, phobias, every manifestation of fear rebranded as disorder. Insurance companies loved it. No pills, no side effects, quick results. Patients sat daily under helmets buzzing with invisible current, emerging calm, simple, empty. Most returned to work smiling. A few never regained the capacity for ordinary anxiety. They walked into traffic, trusted strangers, touched hot irons. The cure performed perfectly until experience required caution, and caution was gone. Meanwhile, in trauma research labs from Zurich to Boston, a parallel branch explored gene expression, the microscopic code that stores emotional learning. Inside each amygdala neuron lie proteins that lock memory when fear strikes. Suppress those proteins, scientists reasoned, and fearful memories never form. In 2005, mice genetically altered to lack the gene, Stathmin wandered open fields where normal mice froze. They explored snake scents without hesitation. Success roared through headlines. Scientists breed the fearless animal. The cruel addition came months later. The same mice failed to avoid predators, failed to learn pain cues, died quickly. Fear wasn't malfunction, it was instruction. Delete the lesson and death becomes curriculum. That revelation didn't stop humans from trying. By the late 2010s, with CRISPR editing now possible in mammals, biotech startups proposed removing the same gene pathways in humans predisposed to PTSD. Investors envisioned peace by design. The trials never advanced beyond ethical review, but leaked proposals showed intent to alter embryos for reduced amygdala reactivity, a hereditary calm. The very idea echoed eugenics with softer lighting. Scientists who objected called it a therapy that cures survival itself. Across decades, the pattern repeated. Every anti-fear breakthrough evolved into its inversion. A tranquilizer created dependence. An electrode program produced apathy. A genetic edit promised serenity and wrote extinction. Each failed success left the same ethical fingerprint. Flawless results, unacceptable outcomes. Public fascination persisted. Films, novels, military briefings, all coveted the notion of warriors unafraid. The irony is that nature already created such people. They exist through damage, not design. Neurology calls it Urbach-Wiethe disease, a rare calcium buildup destroying the amygdala. Only a few dozen cases exist. One famous patient, known as SM, could not recognize fear at all. Researchers released snakes and spiders near her. She laughed. They brought her to haunted houses. She asked to go again. Yet in interviews, she described losing friends, missing warnings, being attacked multiple times because danger simply failed to register. Without fear, she couldn't predict cruelty. Reality became a laboratory repeating the same result. Fear protects. By 2020, the question resurfaced under a new disguise: digital. Neuro-AI startups began building closed-loop systems that monitor emotional patterns via wearable EEGs and deliver micropulses to balance neurotransmitters. Overexcited stress spikes were smoothed instantly, turning panic into serenity before the user even noticed. It sounded miraculous until one device's firmware error locked feedback on. 3 users were hospitalized with flat affect and an inability to respond to danger. Another fatal car accident occurred when a driver failed to brake during an animal crossing. Investigators listed cause of death as inattention associated with adaptive neural device. The marketing vanished quietly. Inside universities, graduate students still study the circuitry of fear with reverence. It is no longer fashionable to talk about removal, only regulation. Yet the specter of deletion remains. To funders, the phrase "without fear" tests better than "with balance." The promise sells. Every decade, a new generation believes they are gentler surgeons than the last. What unites all these eras, 1950s sedatives, 1960s electrodes, 1990s beta blockers, 2000s magnetic coils, 2010s gene edits, is the same arrogance, confusing repression with cure. Fear isn't a disease, it's memory written in chemistry. To erase it is to delete knowledge of danger, and with it, compassion. Consider the men who ran the original trials. None were evil. All believed they were modern Prometheus, bringing peace by stealing fire from instinct. And like Prometheus, they ended bound to their creation. Careers ruined, data sealed, some treatments reborn decades later under new acronyms. Fear, like truth, refuses permanent burial. In the ruins of one Canadian psychiatric building, archivists recently found hundreds of EEG strips from the ice sleep therapy experiments, perfectly even lines where there should be spikes, tranquility rendered as flatness. The ink still glows faintly blue. Each strip marks a heartbeat that forgot how to defend itself. The documentation is beautiful, deadly beautiful, like ECGs of atomic silence. Modern neuroscience lectures sometimes end with the same paradox slide. Imagine a world without fear. The instructions given to students are chilling. List everything that collapses. Emergency brakes, empathy, law, art, evolution. The list grows until the room falls quiet. Someone always asks the right question at last. What would be left? Somewhere tonight, a researcher in a spotless facility adjusts a control knob on a mouse cage, lowering stress responses by another 10%. The graphs look magnificent, clean, quiet, disciplined. Outside the lab window, thunder rattles the glass. The mouse doesn't flinch. Data recorded. Success declared. The technology exists. The warnings exist. What's missing is patience with imperfection. Because the most haunting truth about anxiety, the brain experiment that erased fear, and everyone who felt it, isn't it that it happened long ago. It's that it's still happening, repackaged with better fonts and safer words. Every time we chase serenity beyond balance, we recreate the same smooth graph that killed the reason to survive it. If this story unsettled you, keep it. That shiver running up your spine, that uneasy awareness, it's fear doing its job. It means you're still alive. Share it, so someone else remembers why the world needs to tremble sometimes. Because when fear finally disappears, we follow.